Hi all, I'm Dr. Bashar Sahar. I'm one of the postgraduate diploma endocrinology students of the University of South Wales, and I've been asked to talk about fine needle aspiration cytology of the thyroid gland. So I'm currently practicing at Zuleika Hospital, Dubai, United Arab Emirates, and it is here where we are doing the fine needle aspiration cytology. And first of all, what we are doing is explain the procedure fully to the patient, its advantages and potential complications. After that, we will ask the patient to sign a consent form so that it indicates that he agrees to do the procedure. Once the patient agrees to do the procedure, then we will go ahead and perform it. So first of all, make sure that the patient is allowed to lie in a supine position and put a pillow beneath his shoulders to allow for neck extension. Then make sure that you are standing not on the head of the patient but just adjacent to the bed, and then make sure that all the necessary equipment for the procedure are available, from slides to needles to alcohol swabs to anesthesia if needed. So the first thing, we need to localize the nodule by the ultrasound machine and make sure from which nodule you want to take a biopsy. From this nodule, let's say this nodule, and after that you need to clean the area by an alcohol swab. After that you need to, after localizing the nodule, you need to bring the needle, which is gauge 25 needle, and you need to allow it to penetrate the skin. You can pass it either perpendicularly or parallel to the ultrasound probe, and make sure that enters into the desired nodule. You need to make a quick motion, and once you reach the nodule, make a quick motion, and after that you need to throw the needle and put it in a 5 ml air-filled syringe. After that you need to expel the contents of the needle into the 8 to 10 slides, and after that you need to put those slides in an alcohol for the sake of fixation, and the alternative method of fixation is the dry fixation. At the end you need to apply pressure by using a 4x4 sterile gauze, and then you put a bandage and wait for a few minutes, observe the patient, and it is then safe to ask him to go home. So the patient will ask what will happen afterwards, and we will say we will send the sample to the histopathology for the sake of preparation and for the sake of seeing what kind of cell the patient is having, and the results can be benign, and it can be cancerous, and it can be insufficient material where we need to redo the biopsy again, or it could be indeterminate. And that is the most challenging scenario, where we may need to redo the procedure again, or we may ask the patient to do a surgery if we feel that, based on an ultrasound, that his thyroid nodule is risky. So in summary, fine needle aspiration cytology is a straightforward procedure. It's very simple and we are doing it quite often in our hospital. Thank you very much. I hope you find this video quite useful. Thanks.